Welcome to the deep dive. Today, we're going to tackle something that you specifically asked about.
Oh, yeah.
RSV and bronchiolitis. And honestly, I get it. This is a big one.
Yeah.
Especially when you're dealing with little ones.
For sure.
It's not just a sniffle. It's the #1 reason babies under a year old end up in the hospital.
What's really concerning is that those early infections, even if they seem mild, can have a lasting impact on a child's lungs.
Oh, wow.
Studies have shown a connection between RSV in infancy and a higher risk of developing asthma even years later.
Okay, so that's serious stuff.
Yeah.
And I know you're also curious about that monthly injection.
Right.
To help protect high-risk babies.
Mm-hmm.
We'll definitely get into that, and we'll bust some myths, too.
Yeah.
Like the idea that antibiotics can magically fix RSV.
Right.
Spoiler alert, they can't.
Nope.
But before we get ahead of ourselves, let's break down exactly what we're dealing with here.
You're right. Let's start with the basics. Bronchiolitis is basically an inflammation of the smallest airways in the lungs.
Okay.
Those tiny tubes called bronchioles.
Got it.
And the usual culprit behind this inflammation is a virus, most often RSV.
Okay.
It stands for respiratory syncytial virus.
Okay.
RSV is so common that almost every child will have encountered it by their 2nd birthday.
Wow, every child.
Yeah.
That's a lot.
It is.
So how does this RSV actually cause so much trouble in those tiny airways?
Well, imagine your airways are like a hallway,
Okay.
and lining the walls are these tiny little brooms called cilia.
Okay.
They're constantly sweeping, keeping things clear of mucus and debris.
All right.
But RSV comes along and basically throws a wrench in the works.
Oh.
It infects the cells lining the airways, causing them to swell up and preventing the cilia from doing their job.
So it's like those tiny brooms are suddenly stuck in molasses, right?
Exactly.
No wonder those little lungs have such a hard time.
Yeah,
And that's when things start to get really scary for parents, I imagine.
you're exactly right. The airways get clogged with mucus, making breathing difficult, especially for babies.
Right.
And to add insult to injury, the walls of those bronchioles get inflamed and swollen, further restricting airflow.
Oh, wow.
This can lead to some pretty frightening symptoms.
Okay, so walk us through those symptoms. I know it starts out like a typical cold,
Right.
but when do things take a turn for the worse?
Initially, you might just see a runny nose, a bit of a cough, maybe a slight fever.
Okay.
But as the virus takes hold and those airways become more obstructed, you'll start to notice rapid breathing.
Okay.
For babies, anything over 70 breaths per minute is a major red flag.
Wow.
You might also see retractions where the skin between their ribs sucks in with each breath as they struggle to get air in.
Wow, 70 breaths per minute. That paints a vivid picture
It does.
of how much they're struggling.
Yeah.
And I know you mentioned apnea as well, those pauses in breathing.
Right.
That's terrifying for any parent to witness.
It is.
So at what point do you know it's time to head to the hospital?
That's a crucial question, and it often comes down to a combination of factors.
Okay.
Can the baby stay hydrated?
All right.
Are their oxygen levels dropping?
Okay.
How severe is their respiratory distress?
Okay.
If they can't keep fluids down, their oxygen saturation is low, or they're really struggling to breathe, it's definitely time to seek medical attention.
And here's where I want to debunk a common misconception.
Okay.
Antibiotics are not going to help with RSV.
Nope.
It's a virus, not a bacteria.
Right.
So antibiotics are simply not effective.
That's absolutely. Right now, there are some medications that might be used in a hospital setting, and you mentioned one earlier.
Yeah.
Synagis.
Synages.
It's a monthly injection that helps protect high-risk infants like those born prematurely or with underlying lung conditions.
Okay.
But this is a preventative measure, not a treatment for an active infection.
So let's talk about what you can do to help a baby with RSV, or better yet, prevent it in the first place.
Mm-hmm.
I know hand washing gets mentioned a lot, but is it really that important?
It absolutely is. RSV is highly contagious and spreads through droplets, so good hand hygiene is your first line of defense.
All right.
Frequent hand washing, especially after contact with anyone who might be sick, is key.
Okay.
Also, keeping surfaces clean and avoiding close contact with people who are coughing or sneezing can help minimize the risk of infection.
It sounds like those basic hygiene practices we all learned back in kindergarten still hold true even for a virus like RSV.
Exactly.
Okay.
In a hospital setting, healthcare workers take even more precautions.
Okay.
Infants with RSV are often isolated, and healthcare providers wear masks and gowns to prevent the spread of the virus.
Got it.
These measures help protect not only the baby, but also other vulnerable patients.
Makes sense. So aside from the obvious hygiene measures, are there any other practical tips for parents trying to manage RSV at home?
Absolutely. One technique that can be surprisingly effective is using saline drops and nasal suctioning.
Oh, okay.
Sounds simple, but it can really help clear out those tiny airways and make breathing easier for the baby.
So it's like giving those little brooms a helping hand, right?
Exactly.
Just clearing out the gunk so they can do their job better.
Yeah.
I love that analogy.
It's about providing supportive care to help the baby through the infection.
All right, we've covered a lot of ground already, but there's so much more to explore. When we come back, we'll delve deeper into the specifics of caring for a baby with RSV, both at home and in a hospital setting. We'll also touch on some fascinating insights from Dr. Paul himself, whose work on RSV is truly groundbreaking. Stay with us.
Sounds good. Welcome back. Let's shift gears a bit and talk about what happens when a baby needs hospital care for RSV.
You know, I was thinking about that earlier when we were talking about those severe symptoms.
Right.
What's it actually like for those little ones in the hospital?
It can be pretty intense.
Yeah.
Nurses are the true heroes on the front lines.
Yeah.
They're constantly monitoring those tiny patients.
Right.
Checking their breathing, heart rate, oxygen levels, making sure they're staying hydrated and comfortable.
Okay.
It's a 240-some job.
And you mentioned earlier that sometimes they use CPAP, that
Yeah.
machine, to help with breathing.
Yeah.
Is that common for babies with RSV?
It depends on the severity of the case.
Yeah.
But yes, CPAP can be a lifesaver.
Okay.
It gently pushes air into the baby's airways, helping them keep those tiny lungs inflated.
Got it.
But even with high-tech equipment, sometimes the simplest things make the biggest difference.
Oh, okay.
Nurses are constantly using saline drops and suctioning to clear out those congested airways.
It's amazing how something as simple as saline drops can provide so much relief.
It is.
Like, those nurses have a whole arsenal of techniques to help those babies breathe easier.
They do, and they're also incredibly skilled at positioning the baby just right.
Okay.
Elevating the head of the bed to help with airflow, making sure they're getting enough nutrition without overexerting themselves during feeding.
It sounds like a delicate balancing act.
Yeah,
Are there times when a baby is just too tired to eat, even if they need the nourishment?
absolutely. Sometimes a baby with severe RSV might need to be put on NPO status.
Okay.
That means nothing by mouth.
Got it.
If their breathing is too labored or they're just exhausted, it's safer to give them a break from feeding
Yeah.
and let them focus on breathing.
Yeah.
Their little bodies are working so hard to fight off that virus.
And speaking of fighting off the virus, you mentioned there are other medications besides Synagis that can be used in the hospital.
Right.
What are those like?
Well, one you might hear about is racemic epinephrine.
Okay.
Think of it like an inhaler, but for babies.
Okay.
It's a bronchodilator, which means it helps open up those constricted airways.
Right.
They deliver it through a nebulizer, which turns the medicine into a fine mist that the baby breathes in.
So it's kind of like giving their lungs a little spa treatment, helping them relax and open up. I can almost hear those airways sighing with relief.
That's a great way to put it. And then there are corticosteroids.
Okay.
These are powerful anti-inflammatory drugs that can sometimes help reduce the swelling in those tiny airways. But there's some debate about how effective they are for RSV, so they're not used in every case.
So it's not a one-size-fits-all approach.
Right.
It sounds like each case is unique, and doctors have to carefully consider the best course of treatment for each individual baby.
You're exactly right. It's about finding that sweet spot, providing the right level of support while allowing the baby's immune system to do its job.
Right.
But in some situations, particularly with those tiny babies who are born prematurely or have other health challenges, RSV can hit them really hard.
Yeah.
There's one more medication that's reserved for those tough cases, ribavirin.
Okay.
It's an antiviral agent, meaning it directly attacks the virus itself.
Got it.
But it's not used lightly because it can have some side effects
Yeah.
and needs to be administered very carefully.
Wow. It sounds like managing RSV requires a whole team, doctors, nurses, respiratory therapists, and of course the parents all working together to help these little fighters pull through.
It really does. And one thing I want to emphasize is that while most cases of RSV are mild and clear up on their own, it's crucial to recognize those warning signs and seek medical attention if needed.
Yeah.
Early intervention can make a world of difference.
I think that's a key takeaway for our listener. It's better to err on the side of caution, especially when you're dealing with a baby.
Definitely.
So before we move on to Dr. Paul's insights, let's recap some key points for our listener.
Excellent idea. We've covered a lot of ground.
We have.
So to summarize, RSV is incredibly common, especially in young children.
Right.
It causes inflammation in those tiny airways, making breathing difficult.
Right.
While it often looks like a simple cold at first,
Yeah.
those severe symptoms, rapid breathing retractions, difficulty feeding, those are red flags that you need to seek medical attention.
And don't forget those antibiotics sitting in your medicine cabinet won't do a thing for RSV.
No, they won't.
It's a virus, not a bacteria. Prevention is key.
Absolutely.
Wash those hands, keep those surfaces clean, and for those high-risk babies, that Synagis injection can offer a crucial layer of protection.
Right. And if a baby does need hospital care, there are many ways to support their breathing and help them through the infection, from simple saline drops to more advanced therapies like CPAP and medication.
So many tools in the toolbox. And speaking of tools, I'm really excited to share what we learned from Dr. Paul.
Yeah.
His video offered a completely different perspective on RSV, one that goes far beyond the individual patient.
His insights are truly remarkable. He really highlights the global impact of this virus and the need for greater awareness and research.
That's a great segue to our next segment. When we come back, we'll delve into Dr. Paul's fascinating work and explore those broader implications of RSV. Stay tuned. All right, we're back and ready to hear what Dr. Paul has to say about RSV. I have to admit, I was surprised by some of the things he talked about in that video.
Me too. It's easy to get caught up in the day-to-day realities of caring for a sick child.
Yeah.
But Dr. Paul really zooms out and shows us the bigger picture of RSV.
So what were some of those big picture insights that stood out to you?
Well, he emphasizes that RSV is a global issue,
Okay.
not just something we see during certain seasons or in certain parts of the world. Millions of children are affected by it every year. And in developing countries, it's a leading cause of infant mortality.
Wow. I had no idea the impact was that widespread. It's hard to fathom that a virus so common could also be so deadly in some parts of the world.
It's heartbreaking. And Dr. Paul really drives that point home.
Yeah.
He also talks about the economic burden of RSV,
Okay.
the costs associated with hospitalizations, treatment, and lost productivity when parents have to miss work to care for their sick children.
Right.
Those costs add up quickly.
It's amazing how something so tiny can have such a huge ripple effect, not just on individual families, but on entire healthcare systems and economies.
Exactly. And that's why Dr. Paul is such a strong advocate for increased funding for RSV research.
Yeah.
He believes that with more resources, we can develop better treatments, more effective prevention strategies, and maybe even a vaccine.
A vaccine for RSV, that would be a game changer, especially for those vulnerable infants.
Absolutely. And he also stresses the importance of public awareness campaigns.
Right.
He believes that educating parents, caregivers, and healthcare providers about RSV, its symptoms, and how to prevent its spread is crucial in reducing the burden of this disease.
Knowledge is power, right? The more we understand about this virus, the better equipped we are to protect ourselves and our children.
Exactly. And Dr. Paul brought up something that I think is especially relevant to you and your concerns.
Okay.
He talked about those potential long-term effects of RSV, even in cases that initially seem mild.
Oh, right. He mentioned something about a connection to asthma and other chronic lung conditions later in life.
Yes, there's growing evidence that early RSV infection can be a contributing factor to those long-term respiratory problems.
That's a sobering thought.
It is.
It really underscores the importance of taking RSV seriously and doing everything we can to prevent its spread.
Absolutely. Yeah. So what do you think, what are your main takeaways from this deep dive into RSV?
Well, first of all, I'm feeling much more informed. I had no idea RSV was such a complex and multifaceted issue.
Yeah.
I think the biggest thing for me is that vigilance is key.
Right.
Knowing the symptoms, understanding the risks, and being proactive about prevention. And it's not just about protecting my own family, it's about thinking about the bigger picture, those vulnerable populations around the world, and the need for continued research and awareness.
I think you hit the nail on the head. Vigilance, prevention, and advocacy. Those are the key takeaways. And, if you're feeling inspired to learn even more, Dr. Paul's work is a great place to start.
We'll definitely include a link to his video in the show notes for you.
That's perfect. It's been great diving into this topic with you. I hope you feel more empowered to tackle RSV head on.
Absolutely. It's amazing how much you can learn in just a short amount of time when you have the right information and a curious mind. So, to our listener, remember, knowledge is power. Stay curious, stay informed, and until next time, keep diving up.